Okay, well, it looks like it's slowed down a bit. So we've got 54 people with us right now. I'm sure we'll have a few more joining over the next couple of minutes. Welcome. Thanks for joining us this afternoon. My name is Joe Sawyer. I'm the superintendent of schools here in the Shrewsbury Public Schools. Today is our first day back for our staff. We had our all staff opening meeting in the Shrewsbury High School Stadium today. And that was followed by a variety of meetings out in the schools and some professional development for staff in the afternoon. Based in their schools. We've got another professional development day tomorrow, and then the students begin grades 1 through 12 on Wednesday, excuse me, and kindergarten and preschool on Thursday. I continue to struggle with some allergies, so please bear with me. Excuse me. Okay, so I have a couple of guests with us, Noel Freeman, who's our Director of School Nursing, and Dr. Timothy Gibson, who is our school district physician. He is a pediatrician who practices at UMass Memorial and is also on the faculty at UMass Medical School. And in about 10 minutes or so, Dr. Andrea Cirinello, who is a physician we've been consulting with, an infectious disease specialist, who's from Massachusetts General Hospital and Harvard Medical School, will be joining us as well. All right, so we're going to go ahead and get going. We're up to, I think, 53 attendees right now, and then the panelists. And what I'm going to start, I'm going to share my screen, and we're going to take you through a brief presentation. And then after that, we'll be inviting you, and anytime if you'd like to put questions in the Q&A, the panelists will be able to see those questions, and I'll moderate a discussion with Ms. Freeman and Dr. Gibson and Dr. Cirinello as we go through this webinar. But starting off, again, welcome. This is to share some more information about our protocols and mitigation strategies regarding COVID-19 with the opening of school this fall. And I just want to start with a reminder what our primary goal is. Our primary goal is to provide our students with full-time in-school learning with minimal disruptions, while using mitigation strategies to minimize the risk of anyone contracting COVID-19 in our schools. Obviously, our first priority always is the health and safety of our students and our staff, as well as our families. That's something we focused on greatly last year. We had, despite the challenges, a very successful year mitigating the potential spread of COVID-19 within our schools, and we are following variety of guidance from the Center for Disease Control, as well as physicians we're consulting with, including Dr. Gibson and Dr. Cirinello, in developing our mitigation strategies this year, many of which are continuations from last year, some of which have been adapted a bit. I do want to, before turning it over to Ms. Freeman to talk about some of the FAQs around what we're doing for mitigation strategies, I want to talk a little bit about first our overall approach again, providing full-time in-school learning, providing those mitigation strategies, and of course also supporting our students' social, emotional, mental health, and educational needs. As we've expressed in the documents we've sent out to you so far, when we presented to the school committee a couple of weeks ago, we know that all of the major medical and public health organizations nationally are promoting students being in school in person as a very important goal. And that essentially outweighs the risk in terms of what we think of the lower risks or low risks of students to COVID-19 in the school setting, because of the importance of not only students' academic development, but especially their social and emotional well-being. And that's something that, based on the year that we experienced last year, certainly locally, but as well as a state and national context, we know that students being in school is especially important. And that is our key goal this year. Now, certainly at the same time, there are concerns that people have due to the emergence of the Delta variant of the coronavirus. And that's something that has increased risk more than what we were seeing back when we broke for school in June and early July. And we all know that case rates have been rising over the course of the summer. At the same time, I think it's important to look at our context locally in Shrewsbury. as well as in the state of Massachusetts, because we also are seeing a lot of national level news where we're seeing surges of really high case rates in other places in the country, obviously, particularly Florida, the Gulf Coast, Texas, some other areas of the country as well. And that's just not the same reality that we have here in Massachusetts. And hopefully we won't be going in that direction. And based on the vaccination rates in Massachusetts, the experts say that we shouldn't see that kind of surge. But just for some statistics, I wanted to share with you that over the past 3 weeks in the town of Shrewsbury, the case counts have been in number of positive cases in the entire community have been 21, 32, and 33 over the past 3 weeks. And that is something that I was certainly pleased to see the numbers stabilize. Hopefully that continues to be the trend. And at the same time, we have access to which members of our student body have tested positive. We have direct access to the database. So we do not rely on families letting us know. We can see when a student turns up in the database from having been tested and testing positive. And you can see the statistics there are that we had 3 students the week ending August 13th, 4 students, these are separate students, who tested positive the week end of August 20th, and the week ending August 27th, there were 6 students who tested positive, and those are students across different grade levels across the whole district. And for those of you who may be new to Shrewsbury, the total number of students in our district is just over 6,000 students as of right now. So when you look at that number of positive cases for students on a percentage basis, that is essentially 5/10,000ths of 1% to 1,000th of 1% in terms of a positivity rate. Another way of saying that would be 99.999% of our students did not test positive last week. So it is a very small number right now of students in Shrewsbury who have tested positive for the coronavirus. Another piece, just on a statewide context, you can see that these are the breakdown of cases by age. And in terms of the breakdown, they break it down by decades for older folks. They're breaking it down to smaller chunks of 5 years by younger kids. But even with that, it's still relatively, compared to some of the higher numbers of the ages in the 20s and the 30s. We're talking about 1,900, 1,800 students. About 1,800 students ages 0 to 9, and about 1,900 students, almost 2,000 students, or young people, I should say, ages 10 to 19 in the entire state of Massachusetts. So relative to other ages, a little bit smaller numbers. I also want to point out in terms of the positivity rate, this is from a webpage that Johns Hopkins Medical School or the School of Public Health updates every day. And over the numbers will change slightly day to day, but over the past week, just about every day, except for one day last week, I think when Maine went to the bottom, Massachusetts has had the lowest positivity rate in the entire United States, right at about 2.5%. And they have the green here because the World Health Organization recommends that the recommended positivity rate for essentially reopening things is 5%, where you want to consider different kinds of mitigation. And Massachusetts is well below that, and again has the lowest coronavirus positivity rate in the United States of America as of right now. And then finally, I wanted to share with you another statistic. I mentioned this in one of the communications we sent out at the end of last week, which is that for hospitalizations, these are Massachusetts hospitalization rates by age, what they did start reporting again about a week ago. And you can see that this is on a per 100,000 people in the state rate. So in terms of hospitalizations, you can see the very high, the highest number is in the 80 plus years, where there's 53 for every 100,000 people in that age category. And the very lowest are for children. Children 0 to 11 years, that's a 1 in 100,000 child rate of being hospitalized. For ages 12 to 17 years, 1.4 per 100,000. And for 18 and 19 years, just a 2-year period there, 2 per 100,000. We think the age breakdown has to do with the vaccination breakdown when they initially made it eligible for grades 8 or age 18 and above, and then added the age 12 to 17. But you can see those are very, very low rates, literally 1 in 100,000, or a little slightly 1 to 2 in 100,000 among children in Massachusetts needing to be hospitalized as a result of COVID-19. So I think that's just important context. This is, we're in a very different place than other parts of the United States. Obviously, we still have to take it seriously. We are still in the pandemic, and I do not want to minimize this, but the risk factors are definitely different in Massachusetts and different in Shrewsbury than many other places across the nation. So at this point, I'm going to turn it over to Ms. Freeman, our Director of School Nursing, who does a phenomenal job working with us around all these issues. And she will take you through a set of slides that talks a little bit about the mitigation strategies we have in place at schools, in our schools for this year. And then we will open it up to our panelists, Dr. Cirinello and Dr. Gibson, for some comments, and then we'll be answering your questions that you're putting in the Q&A. But I'll turn it over at this point to Ms. Freeman.
Thanks, Dr. Sawyer. So I am going to jump right in and talk first about some of the mitigation strategies. So as you're probably aware, the Department of Elementary and Secondary Education has issued a mask mandate for all K through 12 schools in Massachusetts through at least October 1st. And there are also federal mandates that require masking on public transportation, including school buses. So everyone in school and on buses will be masking. And we'll reevaluate that in the coming weeks and months and make decisions based on local conditions and state guidance. Of course, hand washing and hand sanitizing is a mitigation measure that works for many infections, and we should really, this should really be a habit that we keep long past the end of COVID. So of course, that will continue this year. Physical distancing will be implemented to the extent possible, which is the recommendation of the CDC, that we have all kids in school and not let the ability to physical distance or not prevent us from doing that. So we will have kids distanced when possible and pragmatic. And it is important to note that by having all kids back in school, there will be places in the district in different buildings where distancing will be limited by the space that's available to us in classrooms and other spaces. And ventilation systems were checked last year to make sure that they meet the necessary standards, and those will be up and running again this year. Continuing on with mitigation strategies, staying home if sick is really one of the most important strategies with the Delta variant and all that's going on. So I will talk a little bit more on the next slide about what symptoms we're asking people to watch for and keep students home if they are having any of those symptoms. And staff as well, of course, will follow that same protocol. Routine COVID safety checks, which are formerly known as pool testing or surveillance testing, which we had in place from February to June last year, will be available again on a voluntary basis for any students and staff who wish to participate. This is something that we're working with the state testing program on, and we're finalizing the details now, so that information will be shared with you as soon as it's available. And the process will start with needing to fill out a consent for students to participate. And finally, contact tracing and quarantine will continue when a positive case is identified in the community, and I will provide a little bit more detail about that in an upcoming slide as well. So the protocols for lunch, students will sit at regular tables. Having all of our students in school again requires us to use our cafeterias as we traditionally have. And this will give kids a more typical lunch experience that they'll benefit from socially. We know that last year, one of the things we heard about most from the students was how much they missed that chance to kind of sit and socialize with their friends at lunch. So we are going to do that in line with CDC recommendations and layer on other strategies during lunch to kind of mitigate the fact that children will, in many cases, be sitting closer together. Again, how close they are is going to be dependent on what space is available in each individual building. So ventilation systems will be fully operating. We're going to have kids sanitize their hands in and out of the cafeteria. They will have their masks on until they are ready to sit down and eat. And that kind of maskless time is going to be as short as possible, and kids will be outside at recess for longer after they have had a chance to eat. So again, masks only removed while they're eating and drinking and then put back on when they're finished. And we'll be heading out to recess as soon as people are ready to do that. Masks are not required outdoors. So when kids get out to recess at lunch or other times during the day, they will be able to remove their masks. Of course, it will be a choice. If there are children who feel more comfortable keeping their mask on, that's completely fine. But recess will be a chance for a mask break. And contact tracing will not include that time. So that time outside, regardless of the length of time they're out there together or how far they are from each other, does not lead to close contact in quarantine. Oh, you can go ahead one more slide, Dr. Sawyer. So what happens if a case of COVID-19 is identified in a student or staff member? What happens to with the positive individual has not changed since the beginning of COVID. People who test positive need to isolate from others for 10 days from the time that they either started symptoms or if they have no symptoms, when the date of their positive test. And once we have found out about a case, we speak to the individual or the parents of the student to make sure that that isolation is happening, and school nurses begin contact tracing at school. So close contacts are considered anyone who was within 6 feet for 15 minutes or more while indoors. However, there are some exceptions that can be made to that rule while in school. So I believe the next slide. This is the list of people who are exempt from quarantine. So anyone who is fully vaccinated and is not experiencing any symptoms would not have to quarantine. Individuals at school in a classroom who are, if both the person who has now tested positive and the people around them, if they are both masked and there's 3 feet or more of distance. Studies have shown that 3 feet is sufficient. So those people do not need to quarantine. There are basically no close contacts on the bus because people will be masked and the windows will be open, creating quite a bit of airflow. So it kind of mimics being outside. So there are no close contacts on the bus. And then individuals who have had COVID in the past 90 days are also exempt from quarantine because data has shown that they are immune for at least that period of time. Next slide, please. So if someone is identified as a close contact and they don't meet any of those exemptions, there are a couple of options. The first of which will be test and stay. This is another part of the state testing program, which we are just getting on board with and getting up and running. So will not be an option for anyone until we get all these pieces in place, but hopefully within the next couple weeks, we will have this as an option. So test and stay means that if you are a close contact to a case in school, and you choose to do this and you've consented to the testing program, a Binax Now rapid antigen test, which is a shallow nasal swab test, would be done each morning through day 7 after exposure to the positive individual. So for that 7-day period, the days in which the person is attending school, they would come into the building, be tested. It's a rapid test that takes about 15 to 30 minutes. And as soon as we get a negative result, as long as the person is still symptom-free, they can remain at school and go on with their day. Obviously, if anyone tested positive at that point, they would then need to go home and contact tracing would begin for that case. Next slide, please. So if someone chooses not to test and stay for whatever reason, they would follow the regular quarantine guidelines that have been in place since last year. One of those options is to get tested on day 5 after your last contact with the positive individual. And if that test is negative and you have no symptoms, you can return to school on day 8. If someone chooses not to test and has no symptoms, they can return after 10 days of quarantine. So they return on day 11. And anyone who has any of the COVID-19 symptoms during quarantine needs to complete a full 14-day quarantine. And that 14-day count starts on your day of last contact with the individual. Dr. Sawyer, you stopped screen sharing.
Sorry, I had a little technical malfunction. It'll be up in just a moment here.
Okay.
1 second.
The next slide is about how students in quarantine will keep up with schoolwork. So I can talk a little bit about that while Dr. Sawyer is getting us back online. So just like any absence in the past, if someone is ill and not up to participating in work, the teachers would just catch them up when they get back. If students are quarantining but not ill, our teachers will work with the student and family to try to provide some work that can be completed at home to keep the student on track. And then again, when they get back to school, they would finish catching up on anything that they need assistance with or they haven't had a chance to finish up yet at home. Next slide. Visitors and volunteers will be allowed in buildings this year. They will need to follow all of the same protocols and mitigation measures that we have staff and students following this year. So everyone will need to be masked. They will be asked to self-screen before they come to the buildings and stay home if they're sick. We are asking for your patience if you're really looking forward to volunteering this year. We understand that teachers may just need a little extra time to establish some routines in their classrooms before they invite you in to volunteer. So patience with that is appreciated. Next slide. After school activities are back. Extended school care programming is returning this year. They are currently enrolling. I believe they have some spots left in most buildings. So if that's something that your family is in need of, you can reach out to Karen Isaacson, the coordinator for that program. Athletics are also in progress, and we are following all of our district protocols and the MIAA protocols for athletics. And any other after-school activities will be reviewed and approved by principals on a case-by-case basis. Next slide.
Okay, stopping there for me. I think that's the last one.
Was there a slide with the symptoms?
I'm sorry, I think that was back a little further. Hold on one sec.
I think I
There we
changed
go.
the order and messed us up. So just to quickly review what the symptoms look like, if you were familiar with the symptom list last year, it's very similar. It's the same symptoms, but the way we look at them has changed a little bit. So the symptoms that you see in bold here, fever, difficulty breathing, shortness of breath, loss of taste or smell, and muscle and body aches that can't be attributed to something like working out, are the symptoms that on their own would cause us to ask you to get tested for COVID-19. The symptoms not in bold are all kind of when they're in combination with another one of those symptoms. So if you have a sore throat and a headache, that qualifies you for testing. But if you just have a sore throat, you don't need to get tested unless, if you've been exposed to COVID, that's a whole different situation. But so these are the symptoms that we ask that all staff evaluate themselves for and parents evaluate their students for before sending them off to school in the morning. If these symptoms develop during the day, the student will be sent to the school nurse and an evaluation will be done to determine if it does require testing, in which case the student would be dismissed to be tested. So I think that is the end of our slides. So I think Dr. Sawyer is going to help us with some questions from the Q&A.
Okay, well, I think before we get into some specific questions, and these are very helpful, and we'll definitely be able to give some concrete answers to some of the questions that have come across. I would ask that if Dr. Gibson and Dr. Serino just might make some brief comments from their context, both Dr. Gibson as a pediatrician and Dr. Serino as an infectious disease specialist, who's also a parent of school-age kids, as is Dr. Gibson. Just thinking in the context of parents and what messages you'd want parents to understand. I know we've talked about balancing some of the risk, the importance of being in school for not only educational well-being, but social and emotional and mental health well-being. And also some of the things that are on parents' minds, and maybe from your perspective, what messages you'd like to give them. And then we'll talk about some specific questions people have raised. Maybe start with Dr. Gibson.
Sure. So my name is Tim Gibson. I'm one of the pediatric hospitalists at UMass. People look frozen. I don't know if I'm frozen for you, but so I take care of inpatients at UMass, and we certainly have had a small uptick in the number of patients with coronavirus who are admitted, but it's not a wave of patients. The patients that we've seen that are sick from COVID look just like adults who had COVID, and they're all teenagers, and the teenagers that we've had who are sick are not vaccinated or haven't been vaccinated yet. So, and that's been only 3 or 4. So we're not talking dozens or hundreds. We're talking just a small uptick. But from a pediatric and development standpoint, the most, last year was a huge change for students. And I think the biggest change for them was remote schooling. And so that, to the credit of the Department of Secondary Education, Elementary and Secondary Education, they recognized that getting back to school was the most important thing for pediatric patients and school-age kids. Many of you know that on the inpatient side and probably outpatient too, we've seen a 400% to 500% increase in the number of eating disorders and suicide attempts. And so getting kids back to school was priority number 1. And then trying to do it as safely as possible is priority 1A. And I think most pediatricians would agree that masks are tolerated extremely well by pediatric patients. And, I think adults feel like it's a bigger deal than kids think they are, especially kids who have gone through it for 18 months now, and it's become normalized a little bit. So when Corona first started and they talked about masking except for those who had a medical reason not to mask, a bunch of pediatricians got together and said, we couldn't really figure out a reason, a medical reason for students not to mask. So it's safe, it's effective, it's well tolerated. And I think that, Noelle and I both have had frustrations all the way along with the state allowing each individual school system to kind of do what seemed fit to them. And we all were glad that the governor stepped up and allowed universal masking to be part of the mitigation process for this year. So we'll continue to keep an eye on things. As Dr. Sawyer said, our state is doing extremely well nationwide, and we're nearly over the hump in our area, but not quite there yet. And with the Delta variant, and others can kind of speak more about this, we have to continue to be vigilant, and I'm glad to see that precautions have been taken as they have.
Thanks, Dr. Gibson. Dr. Cirinello, how about your perspective?
Sure, thanks. So I am, as Dr. Sawyer mentioned, an infectious disease doc here at Mass General. I also have 3 kids in the Northborough, Southborough public schools. So I've been working with a number of school districts since the pandemic started to try to really understand what are the safest ways to have in-person schooling and what are the measures that are really effective to try to prevent the risk of spreading COVID in schools. And we are, I think, really lucky now to have a lot of data from last year that really showed us what measures were very effective. And I think Shrewsbury was a great example of implementing this sort of package of layered mitigation measures that really kept the risk of COVID in the schools very low. This year, with the Delta variant, I think that does introduce a little bit more uncertainty. There are a few more unknowns with Delta than there were at the end of last year. And I think that is an important thing to keep in mind. But we definitely are not kind of back to where we were at square one in the beginning of last year. I think we still know a lot, and we learned a number of really important lessons that stay true. And so I think, Tim mentioned all of the important reasons for not only for education, but also for physical and mental health, for trying to keep in-person schooling operational and trying to have a place for kids to be in in-person school. And so I think, what I can hopefully add is a little bit from the infection risk reduction standpoint. And I think just a couple of really key things that I think will make school as safe as possible this year. I think the first one is really to vaccinate everybody around your kids that can be vaccinated. So if they're 12 and up, vaccinate them, vaccinate everyone in your household who's 12 and up, anyone who they come in contact who's 12 and up. And that will actually really help to protect even the kids under 12 who can't be vaccinated yet. And we're all really hopeful that they will have a vaccine available to them sometime during this school year, ideally as soon as possible. And then the second thing I think is really to continue what we all did I think people did an amazing job last year of staying home when sick. And with all of the discussion about people who can spread the virus while they're asymptomatic, it's still much more the case that people spread the virus when they're symptomatic. And so really just to try to encourage everybody to pay really close attention to how you're feeling, how your kids are feeling. If you have any symptom on that list that Noelle showed, stay home, get tested. The district has a lot of resources available in terms of where to get tested and how to get that done as quickly as possible and get the results back as quickly as possible, so that if you wake up on Monday with a sore throat and a little tiny sniffle, you could read that list and say, oh, it's just a sore throat. But honestly, really look hard and see if there's that sniffle, and go get tested. And hopefully if your test is negative and you feel better the next day, you can be back in school pretty quickly. So I think that's the second most important thing. And then I think the third is just really to think about, the balance of risks. Like, we are probably never going to fully prevent any possibility of getting COVID at school, but we can make it really low, and we can continue to do that with all of the sort of Swiss cheese model that was put into place last year. We sort of line up different protection strategies and each additional protection strategy decreases the chance that something will get through. And I think Shrewsbury has been really done a very good job being very transparent and collecting a lot of data and sharing those data with the community. We've been working with a number of districts to try to collect data about the in-school transmission risk that was seen in public schools last year. And Shrewsbury thankfully joined that study and is continuing to collect data there. So we really are going to have a lot of information as the year moves forward. And I know that the team here is really paying attention to those data, even over the first few weeks of school, to really make sure that things are going well. So I would encourage people to participate in pooled screening, to report your symptoms, and to just really help us, stay on top of these risks and having good information to make decisions as the year goes forward.
Thanks, Dr. Zurinelli. I appreciate that. And thank you, Dr. Gibson. Your perspective is very valuable to us as we give consideration to how to best approach this. At this point, I appreciate some people who put some questions in the Q&A, and some of these I think members of the panel can answer directly. Some are more policy questions that I can try to take a stab at, but I will take them sort of in order of, I'll just take them in order in chronological order here the best I can, but some are the same similar questions. I'll try to group them together. One question was, is there a rule for travel if someone's traveling back from a high-risk area? There is no travel order that exists in Massachusetts any longer. Last year, there was a travel order in place that we asked people to follow, but currently we are not tracking that because there's not an order in place. Obviously, we would hope that families who travel from someplace that was high risk would be considerate in terms of following whatever protocols are advised, but that is not something that is a mandated situation this year. Couple of just straightforward questions. Do we have air conditioning in our schools? The answer is yes for some, are climate controlled. Currently, the New Beale School has full air conditioning. Patton School and Spring Street School had their HVAC systems redone about 3 or 4 years ago. They do have climate control air conditioning. Sherwood Middle School, which is a newer building, has dehumidification. It's not full air conditioning, but it is climate controlled. It's pretty comfortable in there, even when it's very hot. The other schools do not have air conditioning throughout. They have certain spaces, usually the areas that are used all year long, the main office suites, the media center. But unfortunately, we do not have climate control. It's one of my goals sometime before I retire is to have all of our schools climate controlled, because unfortunately, we're seeing more extreme heat events kind of early in the school year and late in the school year. And we also use a lot of our schools in the summer. So that's one of our goals. But right now we're about 50-50. There are a few questions here about vaccination in terms of mandates, in terms of percentages. In terms of percentages, is a question about how many of our students. This town's annual, or rather weekly, report that they do on COVID statistics, the one that just came out this past week on August 27th, the statistics for students, or I should say, Shrewsbury residents aged 12 to 15. Now, most of them are in the public schools. Of course, some of them go to other schools besides our public schools, but there are 88% had at least one dose and 74% were fully vaccinated with 2 doses. For ages 16 to 19, 94% had at least 1 dose and 85% are fully vaccinated. So those are really nice higher rates. And then as far as adults, for fully vaccinated, just for information, it ranged for age people in their 20s. That's the lowest, it's only 61%. And then the next decade, 30s, 77%. Actually, I'm sorry, that's 30 to 49. So 30s and 40s, 77%. People in their 50s up to 65, 84%. 65 to 74, 89%. 75 plus, 85%. So an overall rate in the community of 68% right now with full vaccination. In terms of our staff, Ms. Freeman actually just polled our staff anonymously today. We're going to get some data and we'll share that with the community when we present probably at our next school committee meeting on September 8th. But at the end of last year, we had over 95% of our staff had been fully vaccinated. As far as the questions in the Q&A about mandating it, in my experience, I've never known, and I'm not aware of any to date, of a individual school district mandating a vaccine for students. It's always been a state level mandate. And it remains to be seen now that the Pfizer vaccine has been approved. Generally beyond emergency authorization, whether that's something that the Commonwealth of Massachusetts will choose to mandate, as they do other vaccines such as for chickenpox or measles or mumps or rubella and those kinds of things. But we do not know the answer to that right now. We do not have an imminent effort locally to mandate a vaccine for students. As far as for staff, again, I think we're going to see that we already have an extremely high rate. So I'm not sure that's something that would be necessary to move the needle. And some folks may not be able to be for medical reasons, for example, or may have a religious exemption. But that is something that would be a local policy decision that would also have to be collectively bargained. But the good news is we have some pretty high rates as it is. And as Dr. Cernillo said, that's something that is a huge protective factor. And as Dr. Gibson said, with the cases that we are seeing, we've seen this nationally, that are most complicated and cases with the worst outcomes are happening in people who are not vaccinated. Question about, there's a couple questions about testing. Noel, maybe could you speak briefly to, again, what we're planning on doing for surveillance testing? There's a question whether we do that for preschoolers. There's a question about will it be weekly? And another question about with symptoms, can they do the test and keep kids in school? So you just maybe reiterate that approach that we're taking right now?
Sure. So we are working again with the state program that does provide testing for all students and staff in all schools in Massachusetts. So it does include our preschool. So what would happen is a parent would fill out the consent form that you should be seeing in the next week or so. And then the test is actually a take-home test. So the test kit would be sent home with the student, and parents would help the students do the test at home. It looks like we'll be starting the year with a saliva test, and possibly at some point switching to a nasal swab test, which is what we did last year. Different vendors offer different options. So our option right now is a saliva test that would go home one day and be returned the next day. And we would then have results within about 24 hours of the test being returned. So again, that can be pre-K through 12, and it would be weekly. We probably would send tests home at the beginning of the week. So we would have test results by midweek. And we hope that we have a good level of participation in that testing. The more people that test, the more we know about the prevalence in the community. And what was the other part of the question?
I think just about the test and stay approach.
Oh, test and stay, right. So there is the test and stay option for people who are close contacts at school and want to avoid quarantine. So those people, if they're asymptomatic, would be able to stay in school with a negative test. There is also an option for symptomatic testing, again, through the state testing program. It would be the rapid antigen test. And that is really dependent on whether you can stay or not with symptoms, is dependent on what symptoms you have. So if you have just a headache or just a sore throat, we could test you just for extra peace of mind. And if you're negative, you get to stay. But if you have the combination of symptoms, we could do a test, the rapid antigen test at school, and say, you know, kind of so far you're negative, but you still need to go and get the PCR test outside of school, which is the gold standard test for symptomatic people.
All right, thank you. You know, when there's several questions here about lunches, and I know that's something that we've heard, had a handful of emails from families, some principals, and I've had a handful of emails that have come to me, because that's one of the differences that we have compared to last spring. Last spring, to bring students back full time who wanted to be in school, which was about at least 2/3, in some cases 3/4 of our students, depending on the age level of the school, closer to 90% at the high school level, 85, 90%. And we had a very successful return. There was specifically state mandated sort of 3-foot distancing. The state's removed all of its mandates around distancing. We are following the CDC guidance, which is to have 3-foot distancing wherever possible. And it's possible much of the time, but not all of the time. And it's going to depend on the classroom, the age of the students, how much room there is, how many students are in the class, as far as our classroom piece. But that is something, of course, for right now, we are going to be masking when kids are in the classroom and interacting any place indoors. With the exception, of course, if they're potentially eating a snack in their classroom, taking a mask break in their classroom, if it's the weather's not good, and we do promote going outside for snack or going outside for a mask break, but the weather doesn't always cooperate, of course, and we did deal with that last spring. And different strategies can be used by teachers for that. Sometimes they'll have some of the kids unmask and eat who are separated, and then have other kids, unmask at a slightly different time right after that to do the mask break or the snack. But we have worked through that. Of course, we're opening windows with all wherever possible when we're not fully air conditioned. And we do have a very high level of HVAC ventilation in all of we're maximizing fresh air wherever we can. In cafeterias, we did make the decision to have quote unquote normal lunch. Part of the reason for that, as Dr. Gibson was speaking about, is the more normalizing the social aspect of school. We heard loud and clear from a lot of our students that lunch was not a particularly positive time for them last year, sitting in rows 6 feet apart, not really being able to socialize with peers. And that's something we took into account. There's also some logistical issues when we have all of our students back, including all the students who were home on remote learning last year. We either would have to continue to utilize all of our gymnasium space to keep kids apart more and separated. And because of the additional students, we'd also have to start lunches and end lunches at really early and really late times, which, as you might imagine, gets into some really difficult logistics around all of the other academic elements of their schedule. When they would have special classes, it would essentially eliminate the physical education program when we have to be inside in gyms. And we looked at all the balance and trying to balance all the different issues involved. We did determine unanimously as a leadership team that the recommendation would be to have a more typical lunch, which would result in certainly less than 6-foot distancing. In some cases, maybe even slightly less than 3-foot distancing while kids are eating. And so the approach in trying to layer that approach is to minimize the amount of time the mask is off, have kids come into the lunchroom with their mask on, go through the line if they're getting their lunch. When they eat, take their mask off, and as soon as they're done eating, put it back on. We're going to emphasize getting kids out of the cafeteria and outside to recess as quickly as possible. Or if it's an indoor day, head up to their classroom for indoor recess again, where they'd have their masks on, minimizing that amount of time. And sort of balancing the very low case rate and low positivity rate we have right now. And if we do start to see that there are concerns with that, obviously we will make adjustments. But for the benefit of the program, the benefit of normalizing school to some degree, and having that kind of more typical social interaction, we're going to work hard to provide, again, high levels of ventilation, open windows in larger spaces. And when there are larger spaces, the amount of the potential for the virus to circulate as opposed to a small, more condensed space, all those things are factored in. But there's no question that it is going to be a higher level of risk, and we don't know with the Delta variant exactly how that might play out in that context. But based on the statistics we have right now and the other mitigation factors, we felt this was the right approach to take. So that is where we're at as far as lunches. And I don't know if Noel or Tim or Andrea, if there's anything else you'd add in terms of the context around why it is we're doing this, and then also some of the layered factors and how that might help our approach in terms of minimizing the chances of a transmission at lunchtime.
Yeah, I mean, Andrea and her team at MGH keeps a whole database of the most recent literature. So maybe I'll go first and then I'll let her kind of quote the literature. What we've said all along is that there's, other than everybody staying home for 10 straight days in the entire country, there's nothing that will 100% prevent spread of coronavirus. And you've heard Andrea talk about the Swiss cheese model. When you put multiple layers of Swiss cheese in, the hope is that if it gets through one layer, it's going to get caught by the next layer. So we try to vaccinate as many people as possible. We try to have as much ventilation as possible. We try to have masking as much as possible. We try to have distancing as much as possible. But all of those things come with, or many of those things come with downsides. We're finding out that the vaccine is very safe and has very few downsides. Masking, we've already talked about, has very few downsides. What we found was that distancing had some downsides. Now, not 3 feet, 6 feet, but keeping kids at home had significant downsides. And so I think anybody would admit that lunch is a slightly higher risk than being masked in the classroom, but the benefits of having lunch with your classmates outweighed that risk, while the risk remains small in our community because of the degree of vaccination and the other Swiss cheese models that we're going to put into place. So Andrea may have specific kind of studies that looked at this, and I'll let you kind of fill that in, Andrea.
Thank you, Tim. There are a lot of studies now looking at the risk associated with the various mitigation measures in school. Unfortunately, they were all pre-Delta. So we do have a lot of information, but it doesn't really pertain in the current era. We kind of have to extrapolate based on what we know about Delta compared to the previous variants. What we saw last year was that there was almost no transmission when kids were 6 feet apart at lunch. In Massachusetts, when we looked at the 8 districts that we studied, there were no transmissions from students to other people at lunch. So that, I think, was really reassuring. There were some studies last year where kids were eating at like 1 foot of distance, and there was some transmission that was thought to be due to the lunch period. But in between that and with Delta, it's a little bit of an uncertain area. And so I think infectious disease docs worry about lunch in schools. When we think about all of the things that we are worrying about, that's probably the one that I think the most about. But I think that the points that have been made about the balance of competing considerations is really the important one. And if we want to have all our kids in school full time, which is really important, we have to keep them as far apart at lunch as we can, but we probably can't keep them 6 feet apart and have everybody there. And I think that's pretty much true across the board. I think of all the districts that I've spoken to in Massachusetts that are making their plans for this fall, almost everyone is doing exactly what Shrewsbury is doing, which is to say we're going to try to keep them apart, especially the kids who are too young for vaccination, and maximize all the space that we have. But it won't exactly be 6 feet this year. And I think we will have to see how it goes, really. I mean, I think to the credit of your district, you're really keeping careful track of all of the data and all the cases that you have, and really being very transparent about that. And I think that's really important, because I think we'll get a lot of information and see how well this works. But I think what you guys are doing is really consistent with what everyone else around the area is doing, and also really consistent with the CDC guidance. I think there was a note in the chat about CDC guidance. That's actually, I think, from March. And the more recent ones are really exactly this, like try to maintain distance, but don't keep people out. And there's no specified distance.
Thanks, Dr. Sernello. There's a few other things that are straightforward answers. I'll try to give those where I can answer them, or Noel, but I'm not sure how long the doctors can stay with us. There's one question in the chat about why do vaccinated students have to wear masks? I mean, in terms of the policy piece, is that's been a mandate issued by the state Department of Elementary and Secondary Education, is that all individuals in schools, and all schools, vaccination status regardless, must wear masks. Shrewsbury School Committee made that same decision a few days before the state decided to get into that area, and essentially based that on feedback we were getting from various medical experts, including our guests here today. So maybe, I don't know if Dr. Sernello, maybe you can start, and then Dr. Gibson, why might you think it's important that even vaccinated individuals wear masks indoors?
A great question. I think we've thought a lot about this in the last couple of weeks, and I think there's a couple of key reasons. I think one is that And I'll say that my thinking on this has changed a little bit. I think, in the early part of July, I was not thinking that everybody that was vaccinated was going to need to wear masks. But I think with Delta, it's really changed. We've seen, as people are aware, that although it's much, much less likely that a vaccinated person will get COVID than an unvaccinated person, once they do get COVID, they can have viral loads that are just as high as unvaccinated people, at least for a couple of days, and can definitely transmit to other people. So I think that that's kind of the number one reason for asking everyone to wear a mask. The other reasons are around just the importance of taking all of the measures that we can in the layered mitigation approach to try to make in-person school possible and safe. And so it means that everyone has to kind of pitch in and do that in order to keep the environment as safe as possible. Even if my individual risk is 8 times lower, I think if we all put our risk together, we can all reduce that substantially by everybody wearing a mask. And then I think the last part is kind of, I would defer to Dr. Sawyer and Noel, but from an implementation standpoint, I think most districts steered away from any kind of policy where people at the school would have to try to keep track of who was vaccinated and who wasn't vaccinated, and to try to implement a policy where only unvaccinated people were masking really puts the school staff in a tough position. And I think has them spending a lot of their time doing things that are not instructional in terms of policing who's wearing masks. And also is really hard for kids who aren't able to be vaccinated, maybe by their own choice. So I think, we do have some students who want to get vaccinated who are having that active discussion with their parents and haven't been given that permission yet. And I think just to put them in a spot where they're kind of marked by wearing a mask, I think many districts have felt like that was kind of a tough spot to put people in. So I think those were some of the reasons behind masking. I think the questions are really actively being discussed kind of at the state level as to what would be the appropriate off ramps for masking. Like hopefully we'll get through this Delta surge, cases will go down. I hope we'll be at a place where we can think about unmasking kids really soon. And what would be the benchmarks for doing that is something that I think a lot of people are working on.
Yeah, I mean, for me, it goes back to what are the downsides and what are the upsides. I think in a community where there's low rates of coronavirus and high rates of vaccination, it's absolutely true that masking is less effective. There's just less coronavirus to prevent, but there's still some. And so to have our students mask reduces that even further. And then we go back to the question about what is the downside of masking, and it's very little. I mean, it's tolerated extremely well by pediatric patients. So I was glad that the state stepped forward and made that policy change, because it does make sense with the Delta variant sort of still circulating.
Thank you very much. Trying to get through here. There was some suggestions, and we'll certainly take all the suggestions under advisement that people have. There was a question about air purifiers. We do provide air purifiers in all of our spaces that do not have windows that are used by staff and or students. But in terms of the question about cafeterias, that's something we'll certainly look into. Although again, I want to reassure folks that between the HVAC systems, maximizing fresh air, plus opening windows, we are going to have very strong ventilation in all of our cafeterias. But that's something we can look into a little bit further. In terms of a couple things here, there's a question about the buses. Windows have to be open on buses. That's the rule, no matter what the weather is. So definitely have the kids dress in layers, and kids have to wear their mask on the bus. That's actually a federal federal transportation department mandate. So masking on the bus, and our bus drivers will continue to they're very good at monitoring what the students are doing. Can't see all the kids all the time, but we do have video on the bus, and certainly students typically are pretty good about, at least the younger ones, of letting people know when other kids are not following the rules. That's whatever the rule might happen to be that they're breaking. So I think we'll be pretty good there. And we didn't have really too many issues with that at all last year. Kids have been very, very cooperative about doing what we've asked them to do. Our kids have been terrific about that. There were some questions about, trying to get at the medical ones here. There's a question of whether the Pfizer vaccine is approved for ages 12 to 15 years old, and I don't believe that's the case. I think it's only been approved. What was the minimum age, Dr. Cirinello, that it was approved for?
So there's the two categories of approval that people sometimes think about. So full FDA approval came through for people 16 and up, and it's still authorized for emergency use in 12 to 15. So that means, I think just important to say, that means that it's not experimental. That phase is done when the trials were done. It's authorized for emergency use, and the FDA is reviewing it for full, or will review it for full approval shortly.
Great. Some other folks are asking about the type of mask that is best worn by students.
Do you want me to take that one, Tim?
Sure. I mean, I think that in the hospital, when we go into a room of a COVID positive patient, we wear N95 masks still. But when we go into other rooms and when we're walking around the hospital, we wear regular surgical masks. I don't know what the protocol will be for surgical masks versus cloth masks. Maybe you could pick that up, Andrea.
Yeah, I don't think there's a specific recommendation or requirement at the district level, right? But I can give some thoughts on what I think is the most effective type. I think the most effective type is one that has multiple layers that your student will happily wear all day. So if you have found a mask, I think a lot of people object that masks are uncomfortable. And I've always said that if your mask is uncomfortable, we need to find you a different mask, because there are a million different types out there. And I think there's one that everybody can find that they can at least mostly stand to wear. But for kids, especially because their faces are smaller, the most important thing is that it has multiple layers and that it's really good fitting, so that there isn't a lot of gapping around the sides without a lot of airflow. So a lot of people will do like a surgical mask with a cloth mask over, which just helps improve the fit of the surgical mask. Or you can take your surgical mask and tie a little knot in the straps and then tuck the fabric into itself or under the knot, which kind of just creates a little bit more of a seal here. I think any of those options are great. And those are pretty inexpensive and don't require a lot of, expensive masks that you have to order online, for example. But I think good fitting and multiple layers and comfortable are really the key.
Thanks, Doctor. I know someone asked about mask breaks and how are they implemented, and typically we really try to encourage mask breaks happening outdoors. Sometimes that just naturally happens when students have recess or they have lunch, and that provides it. And we were actually surprised last year. We were expecting students to not tolerate them as well. And so, building them in occasionally, depending on sort of where it is, and the teachers are very sensitive kind of where it is in the schedule, or students might need a break, and we'll do those outside as much as we can. But otherwise, we will do them inside with open windows or alternating who has their mask off and that kind of thing, to make sure the kids have an opportunity to perhaps eat a snack or do that if the weather is not conducive or they can't get outside. But we implemented that very successfully last year. We expect that to be the case again this year. So there's a few questions here too about, in terms of, will there be options for remote learning? And I think it's just very important to be clear that first off, the Commonwealth of Massachusetts Department of Elementary and Secondary Education has essentially mandated that the only learning that counts for compulsory attendance at public school is in-person learning. And so there are not going to be remote options that our district, or other than a very small number of districts that had a program approved, will be providing. So it is not like last year an option to have students do remote learning. And frankly, unlike last year, we just don't have the capacity to provide that. We do not have the funds or the infrastructure essentially this year to be providing parallel tracks of learning for some students who want to stay at home. So the options for families, if they are just ultimately decide they do not want to send their student to school because they feel the risk is not one that they can tolerate, then they can choose to homeschool their child, which means you have to get an approved homeschooling plan through the school district by contacting the school department office, submitting some information, and then you become responsible for educating your child at home, and they are no longer enrolled in the school district. They're not considered to be a Shrewsbury Public School student. They can't participate in any of the Shrewsbury Public Schools. It's not a la carte. You can't homeschool for academics and have them play athletics, for example. It's an all or nothing. Either you're enrolled with us or you're not if you're homeschooled. If you choose to stop homeschooling, if after you've done it, you can immediately re-enter the school district. Any student who lives within Shrewsbury is always eligible to attend our public schools. Other than a few days to get enrolled and situated, that can always be changed very quickly. The other alternative is to either enroll in a private school where you feel that their approaches you're more comfortable with, or it would be to enroll in one of the Commonwealth virtual schools that's approved by the state. Although I understand that they have pretty substantial waiting lists at different grade levels. But while I understand that there is a small percentage of families who would like to continue to have the remote option, that's just not something we can provide this year. The state is not allowing us to for essentially for credit. And in addition to that, we just don't have the capacity to do that. What we do believe is that we have a situation where the risk to children is very low. And just as I am both as superintendent and as a parent of 2 children in the school district, safety, of course, is our first priority. The risk level is not 0, but of course, even prior to COVID, the risk level was not 0 of other contagious diseases, whether that's influenza or other things that can, in a very small percentage of cases, have bad outcomes for children. And it's about balancing that risk with what the day-to-day benefits of in-person schooling. So while I know not everyone agrees with that, our approach is that we are not offering remote learning this year. Let's see, Noelle, are you noticing anything else that's sort of on a medical basis that Dr. Gibson or Dr. Cirinello might be able to help with before we start to wrap up?
I don't think so. There's a couple questions about free lunch, which is not a medical question, but I will just say that lunch is free for all students this year again, regardless of financial status.
Right, that's a federal program, again, that they're offering lunch at no charge to all students regardless. So that, thank you for that. In terms of, there's a couple questions I think about lockers. I believe that, I believe I was speaking to Dr. Jones at Oak Middle School. They're going to begin by not using lockers just because it's a little simpler for students moving around class to class. At the high school, it's been optional to use a locker anyways for probably several years, even pre-COVID. Not a lot of kids choose to use a locker, but I believe they'll be available for students who want them at the high school. In Sherwood, I'm not quite sure. We'd have to check on that. There's a couple questions about class sizes. Fortunately, our class sizes are very good at the elementary level, thanks to the opening of the new school. We've reduced our class sizes across all of our schools, so there definitely is going to be more space to move around. That will also help us in the cafeterias. Excuse me. And each cafeteria is going to have a different situation depending on the way it's built and the kind of furniture they have. But again, we are going to try to space kids out as much as we can. We want to be clear that we're not going to be able to offer the 6-foot distancing that we had in place last year. There's a question of volunteers are required to be vaccinated, and that's not something that we've indicated, but volunteers will have to be masked. We are not tracking visitors' vaccination status at this point. Let's see what else. I think we've hit most of the questions. Some were repeats of the same pieces. And so what I'll do is make sure that we'll go through these, and if an upcoming FAQ that we update for parents, if there are things that are common questions, we'll get those out. If we weren't able to answer your question today, feel free to email Noelle Freeman or myself. Noelle's email is nfreeman, Freeman, at shrewsbury.k12.ma.us. Mine is jsawyer at shrewsbury.k12.ma.us. You can find them on the website. And we'd be happy to correspond with you. But I do hope we are running a little bit over time here, but there's some great questions. I deeply appreciate Dr. Gibson and Dr. Cirinello spending their valuable time with us. And as always, Ms. Freeman is always on top of trying to provide whatever information she can to families. But hopefully this was helpful to you, and appreciate you tuning in. We do
Dr.
intend
Sawyer?
to, yes, go ahead. Noelle.
Sorry, there is one question about whether this is going to be made available online before Wednesday. So I'm not sure how quickly the recording of this is going to be made available for people.
Yeah, we'll get it up as soon as we possibly can. And once we do, we'll send that out, the link out via email. So we'll work with our IT department to get that up as quickly as we can. But it is being recorded, and with the intent that people will be able to see the whole thing. Okay, so with that, we're going to wrap up. Again, thanks everybody for attending. We really appreciate it. I think we had up to 70 at one point. So that's 70 people who are hopefully have more information and feel better about knowing what our plan is. So thank you again. Thank you, Dr. Gibson, Dr. Cirinello. Thank you, Noel. And everyone, have a great evening.